Hi, I'm Shalini. I'm an addiction psychiatrist based at Turning Point and Monash University.
And you were just part of a panel discussion looking at innovations really in models of care, in EDs and beyond really, also in the community. What were the main points you were seeking to get across there?
I guess one of the things that really stood out for me is for many people who come into the emergency departments and for their carers and the loved ones, it's not the best place in terms of being able to access care, but for a lot of people that's the only place that they can go. And I think for me, coming from a drug and alcohol and addiction psychiatry background, what's really important for me is to understand that people who have substance use problems and mental health problems, really we do a disservice in sort of splitting those problems apart, especially in an emergency department setting. People who have those problems are presenting for both those problems and how those problems interrelate. They don't necessarily see their problems as being separate, and I think as a service structure, when we see those problems as being separate, that can create a lot of difficulties rather than solutions for individuals in terms of accessing care. So I think that's one of the key things that really stood out for me in that session.
You also raised the idea of the social determinants of health. That got some attention on Twitter. What was your point?
Yeah, I guess for working with people who have co-occurring substance use and mental health problems, what we systematically see, and this isn't rocket science, we know that for a lot of people who have challenges as a result of their substance use and mental health problems, that's really affected by a whole range of difficulties, including homelessness, experiences of domestic violence, experiences of trauma in childhood. Many of these things are not things that necessarily the solution's not going to be there in the emergency department, but I think we do ourselves a disservice for not really understanding how we can intervene for being able to put a roof over someone's head, being able to get them their next meal, be able to understand how we can keep someone safe in the community. Those are the sort of conversations I think we really need to start to bring into our model of care in our space.
Did you see anything that was particularly promising in that session? We saw these new models. What struck you?
I think it was really inspiring to hear from a whole range of emergency departments across Australia and what they're doing in this space. And I think I'm really struck by sort of the passion of the emergency physicians who work in these departments and the staff who work in these departments. They're really keen to be able to do a better job. I think there's a systematic understanding that we're not really doing the best job that we can for each other or for our patients. So we're actually trying to understand how to do a better job in this space. I think the Panda unit that has been starting to be built in St Vincent's in Sydney is a really interesting space, and I think there'll be a lot of learnings for the rest of us when that's built. But I think it's really understanding about how we can scale up interventions like this, where it's not about sort of single investment strategies, but how we can look at broader approaches across Australia.
What was it about the Panda facility that struck you?
Well, coming from a drug and alcohol background, I think the innovation there is around having a separate space. I think being able to be skilled to manage these sort of emergencies, but specifically around the interventions around clinical toxicologists being embedded in that unit, being able to provide leadership. People who present in an intoxicated fashion to emergency often present with lots of medical difficulties that we don't systematically recognise and we don't systematically treat. And I think that really means that we can have an opportunity to intervene in that space.